The single leg star balance excursion test. This test measures balance while the subject moves about in three planes. It also sets an objective range of motion during a closed chain movement. The subject should place his or her hands on their hips and stand on one leg and squat down just prior to the point where the knee cannot be kept in the neutral position. The knee should appear from the front to be exactly above the foot. Once the appropriate depth has been set, the subject will reach out in front with the non-weight-bearing leg in the sagittal plane. He or she will touch the heel down as far forward as possible without putting weight on that foot. A measurement will be taken from the toe of the weight-bearing leg to the heel of the reaching foot. The subject will then, without touching down, use the reaching leg to move out sideways in the frontal plane and touch the heel down there, again without transferring weight. A measurement will be taken from the toe of the weight-bearing leg to the heel of the reaching foot. Finally, the subject will, without purposely touching, move the hips in the transverse plane and reach behind and touch the heel down for a measurement from the distance of that heel to the toe of the weight-bearing leg. All movements should be performed with the initial squat depth. The subject should bring the reaching foot back to the center each time before reaching out in a new direction. The subject should strive to minimize touching down with the reaching leg, except for when setting the heel down to set a distance for a measurement in all of the planes. A goniometer can be used to check the degree of flexion at the ankle, knee, hip, and lower back. These measurements are quantitative or objective, as are the distances measured from the standing toe to the reaching heel. The sports performance professional should assess the movement in each of the three planes. The sports performance professional is looking for the plane or planes in which the subject exhibited poor balance and control. This assessment is qualitative or subjective. This test assesses the degree of balance and control an athlete has while standing on one leg and moving about in the three planes of motion. The upsides to the single leg star balance excursion test are low cost, relative ease of administration, and it's not a time-consuming assessment. The downsides to the single leg star balance excursion test are judging movement quality is a subjective, and it also requires a scoring mat.